So that sparks an additional thought as well, which is if you think about all the downstream benefits, the patient estimates being much cleaner and clearer, if you think about the benefits from the underpayment review opportunities, alerts and notifications on that side, yes, it's incredibly painful at the front end to put on all the contracts. And then every time you have a contract change, to go in and modify those contracts and update them. But the value, not just for yourself as maybe a practice owner or leader, think about how much it impacts those within the organization, as well as your client base or your patient base as well. Think about how much it impacts everybody else. All right, hey everybody, this is Jason Bryll, founder of Bryll Associates. And with me today is an expert in the ModMed platform, Erin Daniels. On today's call, we'll be talking about some strategies on how to optimize your ModMed instance. So if you are a user of the ModMed EMR and billing platforms, this is a great call to listen into and get in the weeds on a little bit. Just a brief bit of history. ModMed is, an EMR that we've worked with extensively at Bryll Associates. We have a lot of in-depth knowledge of how the platform works. Erin was employed there previously. And then from a data side, many of our clients use this platform. It's really taken over quite well in certain specialties like dermatology. We have a lot of podiatry clients that are using ModMed. So very well adopted platform. And so the goal of the call today is really to help you as a practice optimize the platform for yourself. So with that being said, let's jump right into it. So Erin, I know your time at ModMed, you spent a lot of time working on training and getting people to adopt the platform, especially at the initial phases, larger clients, enterprise clients, and so on. What are some of the things that you would say are the least adopted in the long run? So things that people, if they had just kept going at it or building out that feature, what are some of the top things that you think would optimize the platform experience for users?
Yeah, there's quite a bit, actually. I think one of the challenges practices always find is they have a limited amount of time to go live with the system. And so while there's a lot of things that are taken care of in ModMed, a lot of the documentation comes through with impressions and plans, which is fantastic for the physicians. There's still some things on the practice management side that have to be built out, and it takes a little bit of time. And so quite often what happens is people leave that till later. And they said, okay, we'll work on this stuff later and we'll fill it out. And then it never gets done. And one of the really great things with ModMed is there's a lot of features built into it. So as you're adding data. And so the first one I'm going to say is the payer fee schedule. So that's a big one that is often left to, later date to go ahead and fill in. So just to clarify, that's not your provider fee schedule. That's not what you're billing out to the insurance. So everybody gets those established right away, that you come in for an office visit with me and I'm going to charge you, let's just say $150, right? So everybody's got that already pinned in. It's the payer fee schedule, what the payer allows, that people are not adding into the system. And they're skipping that step till later because it does require going out and finding your fee schedule and getting that information and putting that into the admin side so that it's in there.
Not the gross charge, but the expected reimbursement.
The expected reimbursement, yes.
And so within that module, within entering in that data, where the gross charge might be one charge for that CPT location combination, this is going to be different for every payer, and you can enter it in at the payer level?
Correct. You enter that in at the payer level, which increases the amount of administration that it takes for that. And unfortunately, each of the payers don't have the same fee schedule, so you're entering different values.
Yeah, but obviously there's a ton of value in knowing what those values are and documenting it. Yeah.
Oh, absolutely.
We see this all over the place with different EMRs as well, that it's an underutilized feature if they have it at all. And, it's really complex to manage. So, with that, what are some of the, strategies to keep it up to date? Or is there something that a practice should be thinking about? When should they implement it as well? Like right when you're implementing ModMed, or is this something you come back and fine tune at a later date? What are your thoughts there?
I personally feel if you can get it, at least your major payers entered in as soon as possible before you go live, I think that's the best. One of the things that ModMed's built into it is when the ERA comes in after you've been paid, it will actually give you an alert on there that says that you're not meeting your fee schedule range. So automatically, you're going to have some level of indication if you're getting paid less than your reimbursement amount. So in today's day and age, when just the smallest amount, of revenue makes a difference, at least getting that established for your top payers, I think is crucial so that you can begin reporting on it. And then, taking it even further, if you're doing BI reporting also, then you're able to really see, what's the difference in the range from the different payers and things like that. But just from an out of the box type of thing, at least when your billers are posting ERAs, they'd be able to see if you have a CPT code or multiple ones that are not getting paid at the rate that they're supposed to.
Yeah, so other features are actually impacted by this as well. So those underpayment flags or warnings or indicators, by not optimizing for it, it creates other challenges or lack of optimization with the platform itself. As far as the top payers, just from my own background, when you're implementing the top payers and the top contracts, it's not uncommon to have 10 to 20 be the top contracts and make up 80% of your total revenue. So every practice is a little different. If they're multi-state, it's definitely different. But conceptually, in terms of the level of effort, even having some of those underpayment flags for the top, 80% of your actual revenue mix could be absolutely critical. So what about government payers? How do government payers get impacted by this, by the platform or the contract modeling?
Typically, the government payers aren't too much of a problem. The Medicare fee schedule is always added in automatically by Medicare every year, so that those fee schedules are always updated. Typically, that's not a problem. I think you could probably, want to add in like your advantage plans and things like that because they're not always exactly the same as what Medicare pays. So
yeah, but still, to have even some of that, if you have a large Medicare population in your
yeah,
practice, that makes it a little easier for some of that portion as well, and could be a good
absolutely.
use case to initially have those ERA variance reports and things like that to look at.
So it's definitely something I've always recommended for practices that I've worked with to just earmark that time, that whoever's entering it in, the billing manager, the office manager, the administrator, whoever it is. And I've said this to physicians and physician owners as well, like this is a key part of your business. And so by allowing those people to have that time to get that implemented is going to make a big impact down in your later years, especially with your reporting and your contracts. So as easy as it is to say, I'll do it later, it's really best if you prioritize it as soon as possible.
And one of the things that I'm thinking of as an analyst by trade or a data junkie by trade is if you have those contracts loaded into the platform for somebody like myself or within your institution who does manage your data and analytics, taking those contracts and applying them to your open receivable could give you a really clear depiction over what the value of that AR is. So if you're a larger organization and you're doing kind of a net valuation at month end or quarter or even at the end of the year of what that asset is on your books of your accounts receivable, that could be really vital, especially if you're ever considering getting financing from a third party or looking to sell or be acquired or rolled up. We see a lot of that in the industry as well. So having those contracts would help you get a really clear depiction over what that receivable is worth based on the contracts that you have. So more incentive to get those loaded in and have very defendable rates in there so you can run that analysis.
Absolutely. And then I feel like once you have that information in there as well, that also feeds into like other features like quotes. So you're able to, pull that information in there as well. So there's a lot of additional benefits that go hand in hand with that. So
yeah, that's a good point too. I mean, as simply as a patient walking into the door and getting an accurate quote would be so meaningful And we see a lot of other third-party tools coming out that are trying to make patient relationships more seamless or better, get reviews and so on. And so the healthcare industry is just getting hit all over the place from different solutions. So just being able to have those contracts at expected reimbursement, and then it gives you some clarity if a patient has, copay, deductible, whatever the things are, to get a clearer estimate. I can see that being a massive improvement on the patient relationship side.
Yeah, absolutely. And especially if you're one of the specialties, dermatology, I know it's big in, when I was in private practice, we'd have the kids come in with warts on their hands. And I've had parents say to me, if I would have known this would have been a $3,000 wart,
Yeah.
I probably would have done something different, because every time you're treated with liquid nitrogen, that's a separate charge. And, kids pick at things, so it spreads. Being able to have that quote and understand like what your responsibility is going to be is something that I think everybody's looking forward or looking towards as a consumer of health, of their own health. So at the end of the day,
Yeah.
am I going to do, if I do this, how much is it going to cost me? Because I've
Yeah.
got X amount that I have to apply to my deductible. So how much of this is going to be out of my pocket? So
that sparks an additional thought as well, which is, if you think about all the downstream benefits, the patient estimates being much cleaner and clearer, if you think about the benefits from the underpayment review opportunities, the alerts and notifications on that side, yes, it's incredibly painful at the front end to put on all the contracts. And then every time you have a contract change, to go in and modify those contracts and update them. But the value, not just for yourself as maybe a practice owner or leader, but think about how much it impacts those within the organization, as well as your client base or your patient base as well. Think about how much it impacts everybody else. So there was, I don't know how to cite it, but there was a study about the tolerance for pain that people have. And if you are hooked up to an electrolysis system and getting shocked, if you're doing it for yourself, you quit early. But if you say, hey, somebody else is going to get this from your family, your brother, your sister, your mother, then you tend to go longer. So if you think about doing it for other people, it's got massive impact across the organization. So highly recommend going through the process, committing the time, committing the energy, and creating that value for others in your org. What about other things? We've obviously talked a lot about contracting. There's a lot of benefits in getting those contracts in there and updated. What about other features and functionality that might be underutilized within the ModMed platform?
Was one of the ones that I saw underutilized quite a lot was auto posting an ERA. And that generally came from a distrust. So, you're not sure about the data. And as anybody who's done billing in the past, I'm sure I'm speaking to a lot of people, there's this control, like you're very data oriented. You want to know that you make sure you get that in there accurately. And so to have it automatically done, there's just a giant fear that it's not going to go correctly. And that's always a potential, right? That there is that chance. But I haven't seen that to be the case with ModMed's auto posts. So just enabling that, there's always going to be ERAs that you have to work. I mean, you're just not going to have it every insurance plan going, yeah, what you said is right, and we're going to pay for it, and here it is. That would be great. So you're always going to have some that you're going to have to work. So the more that you can offset and you can have auto post, and then you're only working the exceptions, it just makes it so much nicer and gives you so much more free time to be able to do that work. So you can get together the information to, submit medical records or whatever you need to do. And that'll really help to decrease that AR. And the sooner that you get, especially those ones that are paid correctly, get those done, get that statement out to the patient, and get it out the door so that they can get it paid. And then I would even double down. Really, if you're going to do that and you have ModMed Pay as well, I would honestly say double down and start initiating auto pay after adjudication. And what that is going to do is the patient signs up for it in advance. So there's some sort of financial, some communication that's going to have to happen at the beginning. And they basically say that I'm putting my credit card on file. And when the claim is processed, then you're going to notify me.
Yeah.
And then my credit card is going to be charged for that dollar amount. And it works fantastic. Can you get every single person in your practice enrolled on it? I'd love to see if you can. Chances are there's going to be some outliers, but any percentage you can do is that much more that you don't have to work. So now you've got the services done, you submit it to insurance, you've got the auto posting, so it automatically posts. Now if you have auto pay set up after that, now that's just posted, it's notified me, and it's going to send me a statement. It's going to send me an electronic notice. Your claim has processed, and this dollar amount's going to come out of be charged within X amount of days. Usually people do it within 3 or 5 days. So I, as a patient, have just been notified that my claim processed, it's going to be paid. And then as soon as it pays, then I get a notice as well. So right there, as far as a biller, you're not having to touch those patients that if you've got auto post set up and auto pay enabled.
Yeah. So a lot of different things to touch on here. So with auto posting, this is for insurance, not just the patient payments, but the insurance payment posting as well, right?
Correct. Yes.
And that posting is going to post everything down to the claim, visit, CPT level and match on that level of criteria.
Cart codes, work codes, all of that.
Yeah. And so and Carks and Rucks too. Awesome. So even the adjustment detail. So as those are posted, that should save a lot of administrative time from any posting team members, or if you just use admin staff in your practice, or even the front desk. I've seen different things at smaller groups as well that aren't dedicated posters. Just anybody who has the time to post against those. That keeps your receivable nice and clean. That makes sure that your next statement that goes out to a patient is accurate, because, this was paid even by the patient. This is paid by the patient, so it's no longer open. If you're not quickly applying that, a statement could go out in its normal statement cycle and be inaccurate to that group or that family. So a lot of benefits there, not just thinking about it in terms of, this saves a lot of time in my practice. Yes, that's the obvious, but the less obvious are all the other downstream impacts too that it can have. So walk me through a little bit of the ModMed Pay side. So any patient payment piece of it. So I've seen a lot more of this in the healthcare industry than ever before. And I don't know all the bells and whistles of this platform in particular. But if I'm a patient, the experience is I have my visit, and then I'm asked to basically put my credit card on file or on reserve. Can I put a cap at how much I'm comfortable with paying via that credit card? Can I put a time limit, like you have to run it in the next 60, 90 days? What are some of the guidelines that would make me feel comfortable as a patient if I was to use that feature?
Yeah, exactly. You can put a cap on it. So you can say, don't charge more than, $500, $1,000, whatever you want. And so then that auto pay will only pay up to that threshold. I generally would suggest people not put something like $50, because if you come in for an office visit, you're almost always paying at least $90 to $100 for an office visit. So if you have $50, it's only going to charge $50 automatically, and then you're going to get a statement for the remainder. And I feel like that could be confusing on, a patient scale of like, well, you just charge my credit card. So it's a little nicer to have it all together. But yes, put a cap on there of whatever you feel comfortable as a patient. What I like most about it is, as opposed to in the last 5-7 years, there's been a lot of things at like conferences talking about get prepayment from patients, get prepayments. Well, that's not exactly what your contract says with insurance. And so what I like about this is I'm not waiting on somebody to give me a refund. Because if I go into the doctor's office and I give you $150 and then I only end up owing $90, then I'm dependent on you as a practice to see that and offer me a refund and give me a refund. Yeah. Either that, or I have to call and I have to request it. That doesn't even come into play. So you've already paid your original copay. You have your visit. Your bill is sent out. And of course, as a patient, I can always see my, charges on my website for my payer. So if I'm Blue Cross and Blue Shield, I can see, what's being charged and all of that, and I could see the adjudication. And so your doctor's office then with auto pay is only charging your credit card after it's been processed by the insurance.
Yeah.
So your chance of requiring a refund or anything like that is significantly reduced because you've already got that adjustment amount in there from the insurance saying, this is what we allow, this is what we paid, this is what's your responsibility. So you're only getting charged for your responsibility.
When I hear the refund, discussion, for me, I'm thinking about, okay, so that is a cash outlay to move money back to the patient. So I thought I had money in the bank, but I didn't. So there's the whole financial component of it. There's the patient relationship part of it with incurring, like, well, you overcharged me. Does that make me less likely to come back to you or recommend you as a practice because you overcharged me at the front end? And then there's the timing of it as well. I've worked in some states. I don't know the laws for every single state, but as soon as you are aware of a credit balance, there is a time limit you have to give that money back to the patient. And so laws and regulations in this industry, any industry for that matter, about getting overdue credits back to patients on time. Anything you can implement to reduce the risk of credit balances and reduce the risk of owing refunds, especially to patients, that would just be a massive benefit. Even if it meant that, hey, I'm not collecting the $50 up front, I'm going to put the card down for $250, $500, whatever. So I'm not incorrectly grabbing the data, I think, or the money, the funds. I think anything you can do to prevent that risk to the business is huge benefit to a practice and to the patient too. The statement, I didn't even think about the statement part. That's a good one too. Like, hey, you ran my card and I'm getting the statement. This is all very confusing. So there's a way to mitigate that through this platform as well.
And I've really found at the end of the day, every physician that goes into practice is there because they want to help people. And most of the people in the offices, I really haven't seen anybody in an office, and even in some of the grumpier ones, that really weren't in it initially to help people. That's ultimately what they want to do, and that's what they want to be there for. And I feel like sometimes it's the administrative tasks that take away that joy of the profession that we've all gone into. And it's, now there's so much red tape, there's things to, step around and things like that. So really by using the resources that are out there and, utilizing the system to its fullest potential really gives you that time where you're back to having relationships with the patients again. And the patient is less likely to feel like, oh, they just want my money, and da da da. And, while everybody does have to get paid, let's face it, that's really not what most providers and staff are at the office for. So
anything to make the workflows more efficient and improve the enjoyment of the experience for both the practice, your employees, as well as the patients. These are like we highlighted at the starting of the call. This is you get an EMR because a lot of times it's the clinical documentation and those workflows and certain, the ease of the documentation, the accuracy of the coding, which are absolutely critical to the selection process. But these other features and functionalities that exist to make your experience more enhanced, it's just I'd hate to see people lose out on the opportunity to really optimize the platform that they're paying for. So I think it's also interesting too that as we talk through the most underutilized features based on what we've seen, both of them happen to be in the finance rev cycle type of arena in terms of underutilization, not lack of availability. It's underutilization. So anyway, I think if people are interested in this topic, if you have questions, if you're using ModMed today and you feel like you might be missing out, maybe you're using these, but there's other features that you don't understand, we're happy to address those questions as well. Please send them in. You can send them to my LinkedIn, Jason Bryll, Bryll at LinkedIn, and happy to address these and forward them to Erin, talk about them on a future call, or reach out to you directly. And if you're using a different platform and have questions about, these ModMed features and how they may be different, we have other EMR experience as well. We're not just isolated to ModMed. So happy to be kind of more of that third party set of eyes and talk you through it. Hopefully this was enjoyable and something you guys can walk away and implement, especially if you use that EMR, and look forward to the next call. All right. Thanks, Erin. Appreciate your time.
Great. Thanks, Jason. See y'all later.